Good day, my name is Rosalyn Datua, student nurse from the Notre Dame of Tacorong College, College of Nursing, and today I will be performing the prenatal care and Leopold'S maneuver. So first is we have the equipment needed. We have the 3cc syringe, the tetanus toxoid vaccine, the mother-baby book, and the tape measure. So, first procedure, we need to identify the client and explain the procedure to prevent errors and enhance the client's cooperation and fan his confidence. So, good morning po, ma'am. Ako nga po pala si Rosalyn Datua, ang inyong nurse po ngayon. So, pwede ko po bang malaman ang pangalan nyo?
Yeah.
So, ma'am, magpa-perform po ako sa inyo mamaya ng abdominal examination at saka Leopold'S maneuver mo. Leopold'S maneuver po. So, ang Leopold'S maneuver po ay isang proseso para malaman natin yung position ni baby. So, para po ma-identify natin ng mas maaga if pwedeng may complications sa position ni baby na possible na hindi kayo maka-normal delivery. Okay, thank you po, mama. Thank you. So, next is assess the client's health history, which includes the personal, family, social, previous obstetrical, and present obstetrical data. Information gathered by the healthcare provider will help establish baseline data in identifying teaching needs. So, ma'am, nung bago po kayo magbuntis, sakitin po ba kayo or may mga naging sakit po ba kayo?
Hindi naman.
So, ngayon nabuntis kayo, ma'am. Hindi naman po kayo nanibago sa sarili yung may mga bagong sakit na nararamdaman, ganun.
Wala naman.
Okay. So, next is assess the client's knowledge on guidelines for health, pregnant, and antepartum care. So, to provide a baseline data for identifying teaching needs. So, ma'am, alam niyo po ba kailan yung next niyo na visit, ma'am?
Okay.
May mga ginainom po ba kayo ng mga vitamin, ma'am? Alam niyo po ba yung dapat yung inumin? Okay, thank you, ma'am. So, review the plans for antepartum care visit and examination and laboratory findings to serve as baseline data for succeeding prenatal care. So, we need to review the examination and the laboratory findings. And next is monitor the client's vital signs. It is to provide the baseline data or for future comparison and identify any factors that will place our client at risk of problems. So, next is measure the height on the initial visit and monitor the weight on succeeding visit. So, weight is very important part of each prenatal examination. An increase or decrease in weight will affect the pregnancy. So, next is conduct physical examination. So, beginning from the head to toe and to come up with a general impression of woman's health and well-being. So, next is I will be performing the abdominal examination. So, ma'am, ngayon po, magpo-perform na po ako sa inyo ng abdominal examination. Okay lang po ba? So, next is instruct the client to empty or to void her bladder to promote comfort on her part. So, ma'am, kanina po ba, ma'am, umihina kayo? Ngayon, ma'am, hindi po kayo naihihi.
Hindi naman.
Okay. So, next is position the client in dorsal recumbent. Recumbent disposition will relax the mother and the baby and it will facilitate the easy location and presentation and the lie of the fetus. So, ma'am, pwede niyo po bang itaas yung paa niyo, ma'am? So, ma'am, comfortable kayo sa ganitong position?
Komportable naman.
Okay. So, next is drape the client and expose the abdomen from the level of the xiphoid process down to the symphysis pubis to provide privacy. So, ma'am, pwede, okay lang po ba i-open ko yung damit niyo, ma'am? So, measure the fundic height using a tape measure starting to 0 centimeter to determine the gestation and the growth of the fetus. So, the centimeter side will be facing the client's abdomen while the inch side will be facing the examiner. It is to prevent bias and locate the highest point of the fundus and leave one hand in place and secure the end of the tape measure to the fundus and measure down to top of the symphysis pubis to measure the fundic height correctly. So, document the measurement in centimeter to compare with the calculated gestation. So, the measurement is 38 centimeter. So, next is perform the Leopold'S maneuver. So, ma'am, magpa-perform na po ako ng Leopold'S maneuver ngayon. Okay lang po ba? So, it is to assess the condition and the fetal presentation. Then, before performing, is warm the two hands first by rubbing one against the other before placing to the abdomen. So, the use of warm hands during palpation will prevent the tension and the hardening of the abdominal muscle, favoring good result. So, first is performing the 4 maneuver. During the 3 maneuver, the examiner will stand at the side of the client and facing the client. So, this position will favor the accurate performance of the maneuver. So, we have the first maneuver called fundal grip. With both hands, palpate the upper abdomen of the fundus. For consistency, the head is round, hard, breech is well defined, and for mobility, head is moves independently, breech is less mobile. It is to determine the fetal part lying in the fundus. So first is we need to warm the hand first. So next is the second maneuver called umbilical grip with both hands moving down. Palpate the sides of the uterus from the top to bottom. So one side is smooth, hard, resistant surface, and the other side is angular modulation. It is to determine the fetal back for fetal heart tone, usually found in the left lower quadrant. So next. So next is the pollex grip. So with right hand over the symphysis pubis, identify the presenting part by grasping the lower abdomen with thumb and finger. So assessing whether the presenting part is engaged in the pelvis. So if the head is engaged, it will not move, but if it is soft, it is the back. So to determine the engagement of the presenting part. So lastly is the pelvic grip. So the nurse alters position by turning towards the client's feet. With both hands, assess the descent of the presenting part by locating the cephalic prominence of the brow. So place your finger on both sides of the uterus, about 2 inches above the inguinal ligament. So press downwards and inwards. If the fetal back is palpated, it meets no obstruction. On the other hand, it will meet obstruction. The fetal brow is palpated. So, to determine the degree of flexion of the fetal head. So next is reposition the client to make the client feel comfortable. So ma'am, tapos na po tayo sa ating proseso. Pwede nyo na pong ibaba yung paa nyo, ma'am. So administer the tetanus toxoid vaccine following the recommended schedule. So we have 5 tetanus toxoid vaccine. So first is the TT1, give as early as possible, TT2 after a month later, and TT5 at least 6 months later after the TT2, and the TT4 is at least 1 year later after the TT3, and the TT5 is about 1 year later after the TT4. So it will prevent the mother and the newborn from tetanus. So next is administer the iron folate supplement until the 2nd month postpartum to regain the iron loss during the childbirth. So next is administer the malaria prophylaxis to all pregnant women in endemic areas as ordered by the doctor. So give 2 tablets of chloroquine phosphate every week for the duration of pregnancy. Women are most likely to develop malaria when they are pregnant. So malaria can cause miscarriage, premature labor, small babies, and stillbirth. So provide and promote health teaching on good nutrition and personal hygiene and enough rest and sleep to mother to ensure an optimal environment for health growth and development. So discuss the client her expectation about the pregnancy, which includes the danger sign of the pregnancy, labor, delivery, and the impact on the family. Because psychological assessment is important to assist the client in identifying areas of needs to ensure that optimal fetal growth and development. So plan with the mother the preparation for breastfeeding the baby to know the advantage of breastfeeding to newborn. So next is lastly discuss the importance of prenatal and subsequent visit. It is for follow-up care.